because Congress has not acted. We are facing an unprecedented healthcare crisis. Families are watching their costs explode in real time, and Democrats have been clear. They're ready to negotiate a bipartisan agreement to reopen the government and extend these tax credits so we can stop these massive premium hikes. But Republican lawmakers have to come up off the golf course and off the beach and sit down and negotiate in good faith on behalf of the hardworking Americans like myself who they were elected to represent. You may think that West Virginians are too poor or too uneducated to know when we are being sold a bill of goods, and maybe that's what they are counting on, but there is not one good thing in this bill for West Virginia, and we are not for sale. Where I come from, the stakes could not be higher. If HR 1 takes effect, at least 7 rural hospitals, including Welch Community Hospital, which is the closest medical facility to where I live in Pineville, still 40 minutes away, but a manageable 40 minutes. 7 of those facilities will close within the next 2 years. That means more people driving further for emergencies and regular healthcare visits, more strain on our already fragile healthcare system, and more lives at risk. This ain't about politics. It's about people like my brother, like my neighbors, like my mom and dad, like my sister, and of people that we love back at home. We cannot trade their health and security for tax breaks for the wealthy. It is time for Congress to do its job. Extend the premium tax credits and protect Medicaid and put working families first. Thank you very much for your time today.
Mariah, thank you for your mad. We appreciate it. While the Republican Speaker of the House has canceled 2 weeks of votes, Democrats have remained here in Washington, ready to reopen government and lower health care costs for the American people. Republicans in Congress and President Trump promised to lower prices. They haven't. Instead, the Trump tariffs are driving up costs for small businesses and consumers. The proposed Medicaid cuts would leave millions without coverage, and cuts to the Inflation Reduction Act are pushing energy prices higher. Now, as Democrats fight to protect the Affordable Care Act's premium tax credits, House Republicans are nowhere to be found. This is not what working families need. They need stability. They need a government that works for them, one committed to keeping health care affordable and accessible. Republicans like to say the best health care is a job. But even for Americans working full-time in today's economy, affordable health care remains out of reach. One of my constituents, Ms. Evans from a rural community in my district, I have 4,500 farms in my district, plus the city of Chicago, recently shared her story. She works hard in the agricultural industry and loves her job, but her employer doesn't provide health insurance. Thanks to the Affordable Care Act, she can afford affordable coverage through the marketplace. Before the ACA, many women's preventative services were not covered. Today, Ms. Evans receives annual checkups and screenings at no cost. And because she has a family history of colon cancer, the ACA ensures she can continue to receive life-saving screenings. This preventative care not only keeps her healthy, but it also saves her money and gives her peace of mind. But Ms. Evans is worried if the ACA premium tax credit expire, her monthly costs could double. She earns too much to qualify for Medicaid, yet not enough to afford a massive rate hike. If Republicans believe the answer to health care is simply to get a job, then we should ensure that every working American can afford quality health care. I will continue fighting to stop this Republican manufactured health care crisis and to keep costs down for workers like Ms. Evans. Now, I'm very honored to introduce our next witness who understands the impact ACA cuts will have on rural workers like Ms. Evans. I'm honored to introduce our next witness. His name is Dr. Bruce Pulliam, an emergency physician from Southern Oregon who has spent the last 13 years providing life-saving care in a community hospital setting. Originally from rural Northern California and raised by 2 public school teachers, Dr. Pulliam's path to medicine was made possible through government-supported scholarships, loans, and grants. Resources, he said, were essential to his ability to serve the community he now calls home. Today, he brings firsthand insight into how shrinking public investments in education and healthcare is deepening provider shortages and straining rural hospitals. Dr. Pulliam has been a strong voice for policies that preserve access to care and strengthen the healthcare workforce, particularly in underserved communities. Thank you for your work.
Good morning. Again, my name's Bryce Pulliam. I'm proud to be a board-certified emergency physician, as well as a founding member and the current chair of the Southern Oregon Providers Association, which is part of AFT's Northwest Medical United Local 6552. I live in Southern Oregon and work in a community emergency room. My colleagues and I show up 24 hours a day, 7 days a week, 365 days a year with one goal in mind: to provide excellent care for patients in crisis. Being a doctor is often challenging, but it's become harder because our nation's healthcare system is on life support. Unfortunately, Republican policies are making this worse. This summer, they worked with the Trump White House to enact a partisan law that slashed Medicaid, and allowed healthcare tax credits to expire for working families, all while funding tax breaks for billionaires. They did this at a time when our healthcare system was already at a breaking point, with a national nursing shortage and too few doctors to care for those who need us. Our nation's emergency rooms are packed. Patients receive care in ER hallways, and hospitals are so full that patients have to wait hours or days to be admitted. Television show The Pit doesn't lie. This is real life. As emergency physicians, we see patients with life-threatening emergencies like sepsis, strokes, or heart attacks, but we also pride ourselves in caring for anyone who comes through the doors, including those who come to us because they have nowhere else to turn. If Republicans succeed with policies that defund healthcare, we will see a crisis at every level of our system. Hospitals and clinics will close or cut essential services, forcing patients to travel further and wait longer for care. Up to 14 million people could eventually lose their healthcare coverage, and millions more will see their healthcare premiums increase. This could literally mean the difference between healthcare and being able to afford rent or groceries for the most vulnerable. If we keep cutting from our healthcare system, we aren't just trimming fat, we're cutting to the bone. That means that someone's neighbor, best friend, or family member, like Matt, will have to forego care, skip medication, or delay going to the doctor. They'll get sicker, and both red and blue communities will suffer. I know this as well as anyone coming from a red district in a blue state. It doesn't have to be this way. What we ask for is simple: protect and expand coverage, invest in safe staffing, and fund community hospitals so care is available where people live. I'm here today for my patients, who deserve excellent, affordable, and accessible care. Instead, many are about to receive notice that they're losing the tax credits that enable them to be able to afford health care. All because Republicans' budget prioritizes tax cuts for billionaires over the health of millions of Americans. It's time the Republicans return to DC and do their work. They need to end this government shutdown and work with the Democrats to restore and rescue the health care that's now at risk. I always strive to do what's right for my patients. The Republicans that control Congress and the White House should do what's right as well. Instead of creating a healthcare crisis, they should work with Democrats to fix it. The health of our communities depends on it. Thank you so much.
Well, thank you, Doctor, for your testimony. I want to thank all the witnesses for being here today. I want to thank Leader Jeffries and the congressional leadership for your opening remarks, and to the witnesses all for being here. You know, as has been mentioned, Republicans have the House and they have the Senate and they have the White House. They could end this shutdown today, but they've refused to negotiate with Democrats. And Democrats will continue to fight to protect and save your health care, and Democrats in Congress want to keep your health care affordable. In my district of California's 44th district, 22,000 people will see their health care costs increase and thousands will lose their coverage entirely. For a 60-year-old couple earning $82,000 a year, annual premiums will increase by $13,783 or 286%. That is insane. It's unacceptable. I now will recognize myself for the purposes of a question. Ms. Brooks LaShore, why is it so important for the healthcare tax credits to be extended now? And why can't Congress wait until December, as Speaker Johnson suggests?
Yeah, so thank you so much for the question. The tax credit should have been extended in April. That's when insurers start making estimates of what the premiums are going to look like. They are what we normally see in a normal year is right now, people who are on the marketplaces should be getting notices telling them what their premiums are going to be. And that's why the tax credits should be extended now. And waiting until November 1st is too late, because when people come to the marketplace to shop and have sticker shock, they don't come back. They leave when they see this is not affordable for me. And that's why it's so important that tax credits be extended immediately.
Thank you. That's such an important point. I now want to recognize my fellow co-chair, Debbie Wasserman Schultz, for a question.
Much, Co-Chair Barragan, and thank you to all of our witnesses. And Ms. Brooks LaSure, you deserve the applause as well. So don't. And thank you for your service. I know that CMS job is a hard one. Dr. Pulliam, you're on the front lines, quite literally, of our healthcare system, and I'd like a sense. Now, don't take this the wrong way, but you look like you may have been around prior to when we had more access to quality, affordable healthcare under the ACA. So, over the course of your career as an emergency room physician, can you talk about how our healthcare system has become increasingly under more and more stress, and particularly when patients can only use the emergency room as their primary access point for healthcare? What does that look like when they can't afford their insurance or their deductibles, and the first time they go for healthcare is when it's an emergency?
Sure. So a lot of parts to that question, but I think first and foremost, just to highlight, our system is under stress and stretched to the breaking point. It's hospitals across the nation facing nursing shortages. In communities, we are losing primary care doctors. We're losing specialists that patients need to see for their advanced conditions. Provider burnout, whether it's nurses, doctors, techs, is at an all-time high, and that's driving even more talented people out of the profession. And yet, what we see is patients who come in to the emergency department because that's the only place they can turn for care because they don't have a primary care doctor or they can't get to a specialist. And it's great. I have a federal mandate to see anyone who walks through my doors, and it gives me a ton of freedom to care for literally anyone or anyone that shows up. But I am not an endocrinologist. I'm not a gastroenterologist. I'm not a neurosurgeon. And sometimes to get those patients to those specialty cares that they need, one, we have to refer them. And if they don't have insurance and can't afford insurance, those visits are cost prohibitive. They are hundreds, if not thousands of dollars. And two, when our system is stretched as thin as it is, I see patients who come in who have a first-time seizure, and I say, we need to send you to a neurologist. I refer them to a neurologist. And then I see that